an amputation, which is what they had scheduled at the other hospitals. Honestly, it was, oh my God, what am I going to do now? It was extremely emotional. It was a very scary time. So once I saw Dr. Kar, he suggested that there were other options other than the amputation.
Dr. Musa actually told me a little bit of Barbara's story. I had seen kind of the reports from her at least 2 to 3 prior angiograms on that side. My thought process was, given that I had done so much of endovascular therapy, I kind of know what the setting is. So my thought process after doing the exam, do an angiogram and try to revascularize the leg instead of planning on the amputation.
By listening to you, and you explained the process and what was wrong in a way that I could understand it, and you were extremely confident, but you were honest about that, there were some small chances that it would not work, and I think that when I left there, I felt for the first time that I had someone that knew what they were doing, but also made me feel like there was a chance that I would not lose my foot.
This is he's a great example of what limb salvage means in terms of being able to offer endovascular option, which means, once again, with the small wires and catheters, in terms of being able to open up a vessel so people can forego a amputation, whether that's a toe or foot amputation or a major amputation, meaning a below knee amputation.
I don't have the pain I had before. I'm extremely grateful for the fact that, I can go back to doing all the normal things that I did before. That things they've gone on track the way they're supposed to, and I am very grateful for the saving of my foot. That was a terrible thing to go through, the thought of losing that, and now the thought of keeping it, it's very settling for me, and I appreciate that quite a bit.
Of course, thank you, Barbara. I'm glad you had a good outcome. We'll continue to see you in the office, and we'll continue to manage the situation, whatever comes up.